Hi, I'm Dr. Jonathan Bekich, owner and chiropractor of Lifetime Wellness Center here in Windsor, Ontario. I get a lot of people coming into the office complaining of back pain. They've been diagnosed with sciatica or disc bulges, herniated discs, degeneration in the lumbar spine. And they're told that there's nothing they can do. They've been given one painkiller. When that stops working, they get a stronger painkiller. From there, it starts to be cortisone injections or fusions or hip replacements. And they're not given really any alternative. Some people try things like physiotherapy or massage therapy, and they get some relief, but it just doesn't work. What I tell my patients always is that we need to work from the inside out, because that's the way that our body flows and that's the way that our body works. People are told that they have sciatica, but a lot of times this isn't actually true. You see, most of the pain in our back comes from the joints between our sacrum and our ilium, called our sacroiliac joint. And sciatica, if you didn't know, is actually comprised of 5 different nerves in the lower back. And then they leave and join one big nerve called your sciatic nerve, which goes down your leg. And yes, that can wreak havoc and cause a lot of pain, but what they're not always told and not always focusing on is a lot of people have a lot of sacral tilt or pelvis rotation. And this can be such a big source of back pain. That's why we always take x-rays of our patients to see the alignment of the spine, to see the degenerative changes. The first thing we always want to do is to restore that motion in the lower back and to balance the posture out, thereby relieving a lot of the tension and torsion on the spinal cord, giving the body an opportunity to actually calm down and heal. Without those things being done, the body is always under a constant strain. It's always in our fight or flight state, and it never has an opportunity to actually calm down and heal itself. I'm reminded of a patient in my office. He's a dear friend of mine, a dear family friend who I watched every Sunday at church go from normal posture to start going on a 45-degree angle, started walking with a cane, then a double walker. And eventually one Sunday I just had to ask him, how come you're not coming into the office? I see you getting worse and worse. And he told me, I'm actually scheduled for surgery in a couple months for a fusion because he had a lot of disc degeneration. Doctors told him there's nothing else you can do. You have to have this surgery, you're going to be paralyzed. I said, please come into my office tomorrow morning, Monday morning, and let me just assess you. Let's see what we can do. In a couple weeks of adjustments, he went from a double walker to started walking with his cane again. A couple weeks after that, from the cane to walking by himself. Now it's been months later and he actually exercises again. He lifts weights. He's over 80 years old. By restoring that balance in the spine and in the hips and the pelvis, by increasing the motion in those joints through adjustments, we were able to restore a lot of his function in his lower back. I never told him to cancel the surgery, but he did it of himself, and he said he feels literally 10, 15 years younger. He's able to do things now that he wasn't able to do 10 or 15 years ago because he has that capability back. So what I want you to do is take advantage of our $67 consultation and examination where we're going to assess everything in the body. We're going to take a full history and we're going to send you for x-rays. There's no obligation to care. We just want to see what's going on with you and present you with how we think chiropractic can help you. So take advantage of that offer today, guys.